Good afternoon and welcome to Maine Public Health Association's 2022 Awards Ceremony. My name is Becca Bolas and I'm Executive Director of Maine Public Health Association. I am so excited to welcome you to this very special event and look forward to celebrating our award winners' achievements in public health this evening. Thank you all for being here with us, and thanks to each and every one of you who continues to work hard to support pandemic efforts, in addition to all your work addressing other ongoing community health challenges. Public health workers and volunteers remain at the forefront as we continue to face the worst public health crisis in a century. We recognize everyone's hard work and are so grateful to all of you who continue to go above and beyond to serve your community. Our public health awards this year recognize leadership and service in government, non-government, and volunteerism. Award winners' collective contributions have protected and supported some of our most marginalized community members, advanced science, and demonstrated the value of teamwork. Many of you have worked with our awardees on key public health efforts, and on behalf of MPHA, I want to thank you too for your time and commitment to protecting and promoting public health in Maine. This is the awards agenda for today's ceremony, and I want to offer a few logistics before we get started. We do offer closed captioning, and you should be able to see that in the Vimeo stream. And you can also access it in the link that you received with your confirmation email. If you have any questions or issues with connectivity, please use the discussion feature, and we'll do our best to monitor it during the ceremony. I want to thank Heather Drake, MPHA's Membership and Engagement Director, and Frederick from Event app for all of their support for today's event. I also want to thank Sarah Rines, MPHA's past president, and the other members of our Awards and Nominations Committee for their time reviewing nominations and selecting tonight's winners. There is a lot of impressive public health work being done in Maine, and we received many strong submissions. I want to thank everyone who took the time to submit a nomination for their colleague. The call for nominations is released each February, and if you aren't already signed up, please do sign up for our newsletter so you can receive the call for award nominations next February. And lastly, we want to extend our sincere appreciation to everyone who donated to tonight's event, and in particular to Jeff Gratwick and Lucy Quimby, and to Phyllis and Neil Korsen in honor of their daughter, Anna, for their generous support of tonight's event. It's your support that makes tonight's event possible. So thank you. All right, let's get started. So our first award this evening is the President's Award, which is the highest award given by MPHA. Nominations are solicited and vetted by MPHA's past presidents. Congratulations to the Maine Center for Disease Control and Prevention COVID Case Investigation Team for being this year's award winner. The case investigation team was nominated by Kip DeSaris, who will now share some remarks about why he nominated the case investigation team.
Hello, Maine Public Health Association. I am Kip DeSaris, your MPHA president from 1990, which was the first year that we gave out this MPHA President's Award. I am pleased to present this year's MPHA President's Award. The President's Award is the highest honor from MPHA, selected by a committee of the past presidents. Award this year goes to the Maine CDC COVID Response Team, a group of over 100 case investigators. This group of reassigned state employees, existing epidemiology staff, retired public health folks like me, new MPH grads, National Guard, and others, made phone contact with as many newly diagnosed COVID cases as possible, thousands of cases. They told them about the length of isolation and quarantine, how long they needed to stay home. They identified where they were exposed and any contacts since exposure that were followed up by contact tracing team. They helped people connect with social services so they had everything they needed to stay home, including food. They gathered all the data on case incidents to inform public health decisions, identified outbreaks, and informed cases about treatment options. This team gave people the tools and information they needed to control the spread of this virus. They stepped forward when needed, and they made a difference. So I'm pleased to present this 2022 President's Award to the Maine CDC COVID Case Investigation Team. Thank you.
Thank you, Kip. Dr. Dina Potter will now accept the award on behalf of the case investigation team.
Thank you, Becca. Good afternoon. My name is Dina Potter, and I am the Senior Manager for the case investigation for the COVID-19 response at Maine CDC. I'm truly honored to accept the Maine Public Health Association President's Award on behalf of the entire Maine CDC COVID case investigation team. In March of 2020, the first case of COVID-19 was identified in Maine. At that time, the Infectious Disease Epidemiology Program created the framework for our current case investigation team. The initial team was made up of Maine CDC surveillance epidemiologists and field epidemiologists, plus additional state staff. The team began contacting COVID-19 positive individuals in Maine and collecting data to help inform policy decisions and learn more about the novel disease. Since then, in addition to the original team, there have been 84 redeployed state staff, 106 contracted staff, and 64 National Guard who have contributed to this effort. A case investigator provides isolation and quarantine guidance, collects information on exposures and symptoms, collects information on close contacts, offers social service consultation, and educates on COVID treatment. Additionally, a case investigator thoughtfully and compassionately answers many questions about COVID, and most importantly, is a friendly voice on the phone during a very difficult time. We are called case investigators, but our guiding principle has always been to emphasize that each person we contact is a human being with unique needs. Often, we are a rare human voice reaching out to Maine people who may be sick, scared, and alone. Our work mixes scientific rigor and public health expertise with basic human kindness. Our current Maine CDC COVID case investigation team is an entirely remote team of 70. We have 5 regional coordinators, 48 case investigators, 1 outbreak coordinator, 12 outbreak investigators, 1 education and training coordinator, 1 school liaison, and me. In addition, we work closely and collaboratively with 3 COVID-19 surveillance epidemiologists. We call them COVID commanders, the COVID-19 triage team, Maine CDC field epidemiologists, Maine CDC surveillance epidemiologists, and the Maine CDC informatics team. Since that first case in Maine in March of 2020, there have been over 247,000 cases of COVID-19 in the state, which has resulted in over 118,000 COVID-19 cases investigated and over 1,100 COVID outbreaks investigated. As the pandemic has progressed, case investigators have needed to adapt to many changes in surge status, protocol, standard operating procedures, and new technology. They have worked tirelessly to reach and interview their assigned cases. They also work collaboratively, sharing the positive stories of their calls and offering to help each other when calls do not go well. Case investigators learn about new guidelines in weekly meetings, and then they may problem solve situations on a weekly scenarios call. We are also an active online community with coffee chats, First Friday fests, and sometimes even an exciting round of COVID Jeopardy. A huge thank you to all case investigators for your hard work and dedication to the COVID-19 response in Maine. I am so proud of each and every one of you. Thank you very much to Kip for nominating the COVID case investigation team for the President's Award. Kip came out of retirement to join our team, but he retired again a few months ago. Hey, Kip, please let us know when you're coming back. Thank you again for the honor of accepting the 2022 President's Award on behalf of the Maine CDC COVID case investigation team.
Dina, thank you so much. Our next award is the Public Health Program of Excellence Award. The goals of this award are to increase the visibility of public health initiatives in Maine, promote adoption of effective public health programs, and provide recognition to organizations involved in successful collaborative public health initiatives. Congratulations to the Yarmouth Community Coronavirus Task Force, this year's award winner, recognizing its leadership, collaboration, and volunteer efforts to serve the needs of the Yarmouth community during the COVID-19 pandemic. Maine State Representative Arthur Bell nominated the task force and will now share remarks about its work.
Good morning. It is my distinct pleasure to be awarding the 2022 Public Health Program of Excellence Award to the Yarmouth Community Coronavirus Task Force. If one were to ask this group why they were formed, their answer would be, if we didn't react and respond, who would? The grassroots group of residents formed the very first week of March of 2020, and they had plenty of ambition, insight, skill, training, and resources to meet the needs of their immediate friends and neighbors. The intention of that first meeting, and all those that follow, was to prevent this health problem from spreading in the community and to fill the gaps likely to emerge. Over time, their efforts developed to link other groups in the region to share what they have learned and to leverage resources. The goals of the group were to increase the number of people who may experience, to help the number of people who may experience food shortages, social isolation, medical and transportation needs, stress or anxieties in the wake of the coronavirus epidemic. The programs were created and they evolved as needs emerged. The YCCTF goal was to keep those core services open, provide residents with safe ways to meet their needs, and to work together to mitigate the epidemic and maintain their personal community health. The YCCTF reaches out to residents through the various arms of a program staffed with over 50 volunteers. Neighborhood communicators, call-in centers, sewing warriors, shop gap, pop-up vaccination clinics, COVID testing in homes and at the schools, and months of testing clinics and wastewater testing and reporting. A website, bewellyarmouth.org, was designed and constantly maintained with up-to-date resources. Multiple subgroups have formed to help with the fall flu vaccinations and coordinate and evaluate wastewater testing, identify schedule of COVID testing resources and COVID vaccinations, and medical wellness. Again, it's my distinct pleasure to be presenting this award to the Yarmouth Community Coronavirus Task Force. Thank you.
Wonderful, thank you. Sharon McDonald, Dale Shields, and Carla Hunt, members of the Yarmouth Community Coronavirus Task Force, are here now to accept the award on the team's behalf. Sharon, Dale, and Carla, I invite you now if you would like to make some remarks.
Hello, my name is Sharon McDonald, and together with Dale Shields and Carla Hunt, we are honored to accept the award of Public Health Program of Excellence on behalf of the Yarmouth Community Coronavirus Task Force. Thanks to Maine Public Health Association and also Art Bell, who surprisingly nominated us. Public health is a revolutionary notion. It's collective commitment to community health, and it places the public in the center of action. It's the drumbeat of a vital community. On March 10th, 2020, seeing the signs of the approaching pandemic, 50 people came together in Yarmouth Town Hall to fret and to strategize. Within days, the Yarmouth Community Task Force was launched.
As Sharon said, our community quickly responded to the call. We learned from other communities like Chesapeake Island and shared what we knew with still other communities. A neighborhood communicator network was established to facilitate communication throughout Yarmouth. The Yarmouth Sewing Warriors were born. A call center was established. A shopping program set up. Community testing sites were established. Vaccine pop-up clinics appeared. And encouragement was given to frontline workers. A Facebook page, and as Art Bell mentioned, the Be Well Yarmouth website delivered timely COVID information. But we are only 3 who represent hundreds who served thousands.
The drumbeat of public health that Sharon talks about is the heartbeat that helped us to define community. Who is our community? Who are the ones invisible to us? Our elders, those who lack resources, those whose first language is not English. We repeatedly ask, who are we missing? And we took the COVID support services to their doorsteps through groceries, testing, and vaccinations. We expanded this idea of community to neighboring communities and handed power over to people and organizations to serve their own communities. Suddenly, something that started on a small scale in Yarmouth expanded through state channels to communities in Lewiston, Westbrook, Portland, Millbridge, and so many others. We're all connected, and the larger community is our community. We are all part of the solution. As Layla Bisharat on Shabig Island said, thinking and acting outside of the box and then changing the box are a big part of our story. Thank you again for this award.
Thank you, Carla, Dale, and Sharon for being here, and congratulations. Our next award is the Ruth S. Sharpner Memorial Award, which recognizes an individual who has made a significant contribution in the area of public health. The individual will have demonstrated a broad orientation to health promotion and disease prevention that extends beyond their specific profession or field of interest. Alfred May, Maine Center for Disease Control and Prevention, Public Health District Liaison for the Down East District, is this year's award winner, recognizing his thoughtful perseverance and commitment to bettering the health of the environment and all people in Maine. Kaylee Hess will share remarks now about why she, Patty Hamilton, and Christine Lyman nominated Al for this award.
During the pandemic, while all of us in public health have been working at full capacity, Al May went above and beyond his daily duties as the Down East Public Health District Liaison to make sure the state public health system assessment actually happened. It would have been very easy to put this off given the extra demands of the pandemic, but each time there was a hurdle or delay, Al prioritized the assessment and he pressed on. He convened the steering committee and led the planning meetings, worked with multiple partners to identify and secure a facilitator, researched and made possible a virtual approach to the assessment, which is, as far as we know, the first one that has ever been done, and attended all the sessions. His persistence and leadership on this effort led to impressive engagement from public health partners across the state, including impressively engagement from the Governor's Office of Policy Innovation in the Future. As we reflect and identify strengths and opportunities for improvement in Maine's public health system post-pandemic, Al's impressive efforts on the assessment have ensured that we have the necessary and valuable information on which to base our efforts moving forward. In addition to all of this, Al is pursuing his doctorate in public health at Johns Hopkins Bloomberg School of Public Health, and he secured a project award from that school to improve Passamaquoddy drinking water in collaboration with the Indian Health Service. Al's nominators were so impressed by Al. We are so impressed by Al. His passion, his intelligence, thoughtfulness, and his true commitment to supporting and improving public health in Maine is admirable. He is so deserving of this award, and Maine is so lucky to have him here. Thank you, Al.
Wonderful. Al, I invite you now if you would like to make some remarks.
Good afternoon. Thank you, Becca and Heather and the board of MPHA for supporting these awards. Certainly thank you to Kaylee Hess along with Patty Hamilton and Chris Lyman for nominating me for this award. Ruth Sharpner worked at the Maine Bureau of Health in the 1970s and 1980s, doing planning, program management, epidemiology, and evaluation. Ahead of her time, she authored an article in 1983 that investigated child death in Maine between 1976 to 1980, where she meticulously organized the data results by type of death, age groups, and income levels. I'm honored to accept this award when I consider what Ruth did and stood for. Public health sometimes gets criticized for spending time convening community members and partners to review data and develop multi-year plans. But I believe that this is what puts public in public health, creating an environment for people to actively engage in the system. You are all most likely aware that Maine conducts the Shared Community Health Needs Assessment every 3 years. But the public health system assessment at the state and district level are different, as each looks at our public health system and asks how the system is meeting the national standards within the 10 essential public health services. These assessments can be tied to performance measures, accreditation, state health plans, all creating a roadmap for the system to be accountable in making the necessary changes to improve population health for the better. For the work on the state public health systems assessment, I want to thank our planning committee that first started meeting in December of 2019. For developing a virtual model of this assessment, a big thank you to Lisa Tuttle and Valerie Sawyer of Medical Care Development for being incredible facilitators. And certainly a big thank you to our council coordinators, Emily, Julie, and Maura, for their technical support. On a personal note, I want to thank two mentors. Dr. Tony Eiton was the first health director I worked for at the Stamford Public Health Department in Connecticut in 2001. As I was the lone epidemiologist in a large city health department, Dr. Eiton allowed me to break down silos across all different partners and instilled in me the passion for professional governmental public health at all levels. My second mentor is Dr. Andy Smith, our Maine state toxicologist, who recognizes strengths in all people and provided a platform for sharing work and resources to make our programs and those of our partners better. Finally, a thank you to our public health district liaisons and tribal liaison, who make the connections happen every day among people from local communities, municipal and county governments, community-based organizations, state government, and non-governmental partners. They are resilient and aim for the best quality of life for the people in their districts. Thank you again very much. I appreciate this honor.
Thank you, Al, and congratulations. Our next award is the Phoebe Conrey King Access to Healthcare Award, which recognizes an individual or individuals who have made a significant contribution to improving access to healthcare in Maine. The individual will have demonstrated leadership abilities in promoting increased access to healthcare by all Maine residents, and will have made a significant contribution toward meeting the needs of uninsured and medically underserved populations. Danielle Lauder, co-director of Medical Care Development's Public Health Division, is this year's award winner, recognizing her significant contributions to healthcare access in Maine through broadband expansion, public health initiatives. And Alphonse Allen Laney will now share remarks about why they nominated Danielle for this award.
Hello, everyone. I'm Alphonse Allen Laney, and I've had the privilege of working with Danielle for over 8 years. 5 years ago, I learned Danielle would become my direct supervisor, and I broke out into my happy dance. As you can see from this slide, Danielle wears many hats at Medical Care Development. This slide highlights the major programs Danielle is responsible for. However, there is not enough space on one slide to include all that she does. It would take an entire presentation and a lot more than our time allotment of 2 minutes to cover one day of Danielle's schedule. Danielle is what every leader should strive to be. Integrity, compassion, focused are the first words I would use to describe Danielle. She knows how to get the job done and how to motivate her staff to see that it's a job well done. Before I turn this over to my colleague Reid, I'd like to say a very heartfelt thank you directly to Danielle for all you do to improve access to quality health care for the people in Maine and for being an inspiration to so many of us.
All right. Thank you, Fonz, and thank you to all who helped make this opportunity possible. I'll be brief. I'm Reid Plimpton. I'm the program manager of the Northeast Telehealth Resource Center. I've had the distinct privilege of working with Danielle on Netric and on multiple other projects across my young public health career, including my intern days. I'm honored to get to be a part of the moment of recognition that I believe she so clearly deserves. To myself and many who get to work with her closely, Danielle, in a nutshell, is an individual who has dedicated their entire lives to improving the quality of life for other Mainers while developing a robust and sustainable public health network, along with high-quality healthcare systems to support our fellow residents, starting with those who are the most underserved and undersupported. She's truly an example, a living example of developing the right tool for the right place at the right time, and Maine has benefited greatly from her efforts. Congratulations, Danielle.
Wonderful. Thank you. And Danielle, I invite you now if you would like to make some remarks.
I sure would, Becca. And wow, to follow that, I'm just very humbled. Thank you so much, Becca, and many thanks to the MPHA for your ongoing collaboration and strong advocacy here in Maine, helping address key issues impacting public health, and particularly throughout these past 2+ years now, during which the landscape has constantly been changing and evolving and challenging us all like no other time in our history, as you mentioned to start. I also want to give heartfelt thanks to my wonderful colleagues, as you saw, Reid Plimpton and Phons Allen Laney, for nominating me for this award. It was a wonderful surprise, and I'm so fortunate to be part of their team. Ms. Conrey King made amazing contributions to addressing health access and equity issues throughout her personal and professional life, and I am both honored and humbled to receive the award in her name. I'm also incredibly grateful for our amazing team at Medical Care Development, as we lovingly call us, MCD, which I've called my professional home for almost 2 decades now, alongside so many wonderful partners I've been privileged to work with across the state who are equally passionate about improving the health and productivity of our communities through efforts to expand access to high quality healthcare services and resources for all Maine residents. And finally, to my family, who still isn't entirely sure what I do for work, and I guess I'm not probably alone in that in our public health world, I owe a huge thanks for their unwavering support and understanding when the hours and weeks are long, yet the end result is often months or years down the road. All that mattered to them was that this work is important and it makes me happy. In fact, I want to share appreciation for everyone here this afternoon and to so many others across Maine and beyond who have shown incredible commitment to enhancing access to healthcare through innovative solutions, including but not limited to expansion of telehealth and affordable high-speed internet for all, among many other efforts to help address workforce shortages and other key barriers that we're continuing to face. I've been fortunate to work with so many of you from York to Aroostook counties and everywhere in between over the years, from developing a network to enable rapid response to stroke via telehealth, integrating telebehavioral health services into our schools to address the current mental health crisis, and so many other projects, including work that I was very fortunate to be involved in with a great group of partners to expand broadband across the state of Maine under Governor Mills' leadership. And while the collective work to improve health access and outcomes can undoubtedly be challenging, and COVID has certainly put us to the test as of recent, the rewards win out every time. And I can't imagine a more fulfilling way to focus my time, nor a better group of colleagues and friends to be on this journey with. So many thanks again, and a big congrats to all of my fellow MPHA 2022 award winners. Thanks again.
Thank you, Danielle, and congratulations. And you are definitely not alone in that, in trying to explain what we do sometimes. Wonderful. All right. Well, our next award is the Pamela M.B. Studwell Tobacco Policy Award. And this award is given to an individual whose dedication, persistence, and passion for improving lives has significantly advanced best practice tobacco policies in Maine. Vicky Wiegman, substance abuse coordinator, counselor, and tobacco treatment specialist at Lewiston Public Schools, is this year's award winner. Emily Dooling Hamilton will now share remarks about why she nominated Vicky for this award.
For the past 35 years, Vicky Wiegman has been substance use prevention counselor for the Lewiston Public Schools, where she excels at providing high-quality tobacco programs and initiatives. She has made tobacco cessation counseling easily accessible for her students and has worked with over 350 students on quitting tobacco during her career.
This is a message for Vicky. You are an amazing inspiration to so many in the prevention field. You are what we call a protective factor. The work you've done locally and statewide has touched so many lives, especially your work on the credentialing board. We would not have substance use prevention specialists in the state without you and all the work you've done. Thank you for everything you do for so many.
Hi, Vicky. It's Fred. Wishing you a heartfelt congratulations on this very well-deserved award. Vicky, I have so valued working with you over the years as part of the tobacco treatment training program and the many adventures that we went on across the state, and also as fellow commissioners on the Tobacco Certification Commission. Your wit and your intellectual prowess were always so appreciated by all of us who worked with you, and you brought so much insight to our work.
Hi, Vicky. Tina Pettengill. I am so excited that I was asked to congratulate you on the Pam Studwell Tobacco Policy Award. As someone who knew and loved Pam, I know how pleased she would be to hear that you are receiving this award. Someone who has dedicated their life to our youth and to prevention of tobacco use and treatment of tobacco use with empathy, compassion, and just an attitude of never quitting, of always doing what it takes to make progress against big tobacco. Thank you, Vicky. Love you.
Say congratulations. Say congratulations.
Vicky's dedication to reinforcing healthy behaviors not only demonstrates a deep commitment to her community, but also the dedication to the individual lives of students, parents, and citizens. Her involvement and love for her career contributes to the success of people she has worked with. Thanks so much, Vicky.
Wonderful. Vicky, I invite you now if you would like to make some remarks.
Adding the grandbaby. Good afternoon. I'd like to thank my colleagues, Emily Dooling-Hamilton and Healthy Androscoggin, for this nomination, and my prevention and tobacco friends, Leanne Dodge, Fred Wolf, and Tina Pettengill for their support, as well as the selection committee at MPHA for selecting me for the Pamela M.B. Studwell Tobacco Policy Award. I'm humbled by this for many reasons, not the least of which is having read the amazing accomplishments of Pam Studwell in the field of tobacco policy. In 3 weeks, I'll retire from 35 years in my job as Substance Use Prevention Coordinator and Counselor for Lewiston Public Schools. Throughout my career, my primary driving force has been around all things tobacco, with a sincere belief that this focus would allow me to prevent and intervene with the entire population of youth. I take tremendous pride in this work. Please, everyone, do everything you can, whenever you can, to help prevent this continued scourge on our youth population. We know they deserve better than this. They deserve to move forward through their teen and young adult lives, free from nicotine dependence and all the pressures that lead them to it. We need to help make a tobacco-free world a reality for them and future youth, including my beautiful grandbaby, Sydney. Again, many thanks for this honor.
Thank you, Vicky, and congratulations. Our next award is the Public Health Policy Champion Award. This award recognizes a policymaker who has made a significant contribution to public health in Maine. Anna Korsen, Program Director at Full Plates, Full Potential, is this year's award winner, recognizing her leadership and commitment to increasing school meal accessibility for all children in Maine. She was nominated by Renee Page, who will now share some remarks about why she nominated Anna for this award.
Wow, this is great. Thank you, MPHA, for accepting my nomination of Anna Korsen from Full Plates, Full Potential for this prestigious Public Health Policy Champion Award. I know traditionally this award is given to lawmakers, so I am extra excited that as a young leader who formed and led a coalition of childhood anti-hunger advocates to successfully pass 5 critical pieces of legislation during the 130th legislature, that Anna is being recognized. It is rare for multiple pieces of legislation to garner so much support, particularly when they require fiscal note. Anna's successful trust building to bring together numerous stakeholders from both sides of the aisle in multiple sectors was critical to this success. She convened advocates ranging from farmers to school nutrition staff to public health experts to impacted youth. Anna helped supporters submit letters to the editor, feel comfortable delivering testimony before the legislature, and see the power of grassroots organizing when something is really worth fighting for. The most groundbreaking legislation to come from Anna's work is Maine's permanent expansion of free meals to all students, one of the first states in the nation to do so. This is truly a dear-ago moment for Maine and the country. Universal free meals is not a new idea, but it is one that has yet to gain traction until now. Anna and Maine are showing policymakers at the federal level that this can be done. Addressing inequities faced by low-income families, breaking down barriers to accessing Maine-grown food for school meals, and providing adequate time for students to enjoy their lunches address many social determinants of health. All of these strategies are rooted in primary prevention. Rather than just feeding kids who are experiencing hunger, Anna worked to address some of the upstream root causes of hunger issues. Arguably, you could say that she was just doing her job, but it is clear that Anna goes above and beyond. Anna Korsen is a leader in childhood anti-hunger advocacy, and the outcomes of these successes will have impacts on Maine kids' health for years to come. Thank you, Anna.
Wonderful. Thanks, Renee. And Anna, I will now turn it over to you if you would like to make some remarks.
Wow, I am so honored to be receiving this award. Thank you, Becca and the Maine Public Health Association. And I would also like to thank Renee Page for taking the time out of her very busy life and important public health work to nominate me. It means so much, and I'm incredibly grateful. Systems change work takes all of us, and there are so many people that should be recognized for their part in this work. Our legislative successes have been a team effort, and the future is looking brighter for Maine kids thanks to so many dedicated people. I'd like to take the time to recognize and thank all of them. Thank you to John Woods, Justin Alfond, and Laura Pinio for having the vision of a Maine where no child goes hungry, and for believing in me and giving me the opportunity to do this work. Thank you to the small but mighty Full Plates team, Clara McConnell and Mike Saxel at Main Street Solutions, Governor Mills, Senate President Troy Jackson, Speaker Ryan Fecteau, and the 130th Maine Legislature, the Maine Department of Education, and a special thanks to Walter and the Child Nutrition team, school nutrition professionals who work tirelessly to feed kids across our state every day, our many, many partners and collaborators across the state and country, students, parents, and so many others who lended their voices to this effort, and my friends and family, especially my husband, Brian, and son, Arlo, for always supporting me and cheering me on. Thank you so much. And congratulations to all of the other award recipients this evening.
Congratulations again, and thank you, Anna. Our next award is the Public Health Journalism Award. This award recognizes a journalist or a team of journalists who have made a significant contribution to public health in Maine. Rose Lundy, public health reporter at the Maine Monitor, is the recipient of this year's award. Rose was nominated by Ed Maleo, who will now share some remarks about Rose's work.
My name is Ed Maleo. Prior to joining HealthReach Community Health Centers, I worked for the Maine CDC through its Public Health Emergency Preparedness contract with AdCare Educational Institute of Maine. It is my pleasure to nominate Rose Lundy, reporter with the Maine Monitor, for the Maine Public Health Association's Journalism Award. I first met Rose, virtually of course, in late 2020. Rose reached out to discuss our public health volunteer efforts, and specifically our first deployment into a long-term care facility, a place hard hit by the virus and dangerously short-staffed in rural Deer Isle. I was not able to give a good first or perhaps even second impression, as I was working ungodly hours supporting planning and response efforts. I put her off several times. Rose was nevertheless patient and persistent, and eventually I was able to find the break in the action to speak with her. Despite my delay, she was exceptionally pleasant and passionately inquisitive when we finally spoke. I'm secretly an avid newsreader. Naturally, after Rose got our program in the paper, I became a follower of the Maine Monitor and Rose's subsequent articles. Like my volunteers who were doing incredible, thankless work, Rose brings attention to statewide efforts, the many challenges we face, and she overall provides her readers with the background necessary to make sense of critical health topics in Maine. Rose has thoroughly and passionately reported on items of interest as the COVID-19 pandemic has impacted all aspects of public health and healthcare. Her balanced, informative approach to reporting has been insightful in so many ways. Her patience and studiousness have earned her praise from myself and my former colleagues at Maine CDC. Rose, congratulations, and thank you for both seeking out and raising awareness around the important threads that run across our community and the intricate health system that supports it.
Thank you, Ed. And Rose, I now invite you if you would like to make some remarks.
Thank you, Becca, and thank you to the Maine Public Health Association for this award, and to Ed for nominating me and for the kind words he said. I'm super overwhelmed but grateful to receive this award, especially at a time when we've seen how public health impacts all aspects of our lives. I'm fortunate at the Maine Monitor to have worked for some incredible editors and mentors, including Dan Dinsmore and Eric Conrad and now David Dahl. So I'm really lucky to learn from them every day. And my fellow colleagues at the Maine Monitor, we have the privilege of getting to do long form investigative journalism. So we're really lucky in that way. We're a nonprofit, free online if you haven't heard of us, themainmonitor.org. So feel free to check us out. And finally, I would just say that my job would be impossible without the help of all of the public health professionals who have spoken to me for all of the different stories I've worked on, including a number of the winners here tonight. Congratulations to all the other winners. And then to all of the other Mainers who have just shared their experiences with me and sometimes their deeply personal stories about public health. I'm just so grateful and lucky to get to do this job. And I'm honored to receive this award, and I'll use it as inspiration to keep telling some important public health stories in the future. So thank you again, and congratulations to everybody else.
Thank you, Rose, and congratulations to you. Our next award is the Public Health Business Champion Award. This award recognizes a business for its leadership and commitment to integrating and promoting public health values into business practices. The Jackson Laboratories Tewhey Laboratory is this year's award winner, honoring its leadership and partnership to protect public health and provide Maine with critical expertise in genomic surveillance during the COVID-19 pandemic. Kara McDonough nominated the Tewhey Laboratory for this award, and she will now share some remarks about its work.
Hey everyone, this is Nirav Shah from the Maine CDC, and I wanted to take a second to thank Ryan and all the members of his lab at JAX for the amazing partnership that we've had throughout the pandemic. In particular, I wanted to take a second to thank all of you for partnering up with us to undertake a massive project of genomic sequencing on so many of the COVID-19 samples that we've received. We literally would not be here were it not for your partnership. And because of that, we've been able to stay one small step ahead of COVID throughout. We've been able to get a sense of what's happening and what we can project might be coming our way as a result of this genomic sequencing. So on behalf of all of us here at the Maine CDC, to Ryan and everybody in the lab at JAX, we thank you for your partnership. Job well done.
Wonderful. Brian Tewhey, Assistant Professor and Principal and Investigator of the Tewhey Laboratory, is here to accept the award. Brian, I turn it over to you.
Sorry, I think I would have figured out the mute after 2 years here. First, I'd like to thank the Maine Public Health Association for recognizing the team's work with this award and Dr. Shaw for his kind words. I'm delighted to accept the award on behalf of the small team here at the Jackson Laboratory who have worked for the past 2 years to provide COVID genomic sequencing support for the Maine CDC. This team includes Hannah Dewey, our computational scientist, Susan Kales, Ryan Lynch, and Daniel Brenzi, who have worked in the laboratory generating data. They're the ones who have truly made this work possible. So I came to Jackson Laboratory 5 years ago to start a research group focused on understanding the genetics of complex human diseases such as type 2 diabetes and autoimmune disorders. I hoped at some point I could give back to the state that I'm lucky to call home, but I never expected it to be in response to a global pandemic. And in March of 2020, we contacted the Maine CDC to ask how we could help. The Maine CDC has an incredibly advanced genomic sequencing capability. However, a community effort was needed at the time, and the Jackson Laboratory, with our world-class infrastructure on DNA sequencing analysis, I thought could help. It's been a wonderful partnership over the past 2 years. I've been in awe with the staff at the Maine CDC. I've had the opportunity to get a small glimpse into the dedication and tireless work throughout the pandemic. And if we've moved an anthill with our sequencing work, the Maine CDC has truly moved mountain ranges during the pandemic. I'm delighted to see members of their team receive praise tonight that they so fully deserve. I feel lucky to have had the chance to work with them. So thank you again for the entire team here at the Jackson Laboratory. We look forward to continuing our partnership with the state and potentially identifying new opportunities where we can apply our expertise to better the health of Mainers. Thank you.
Thanks again to you and your team for being recognized with this award. Our next award is the Public Health Rising Star Award, which recognizes a young professional in Maine who has made a significant contribution to public health. Mercedes Sadie Foshay, Medical Volunteer Management Coordinator with AdCare Educational Institute of Maine, supporting Maine CDC Maine Response, is this year's award winner, recognizing her leadership and rallying Maine's volunteers to protect public health during the COVID-19 pandemic. Ed Molio, who you heard from earlier, will share remarks about why he nominated Sadie for this award.
My name is Ed Molio, and I now direct communications and outreach efforts for HealthReach Community Health Centers. Prior to this, I managed our state's public health volunteers on behalf of the Public Health Emergency Preparedness, or PHEP program at Maine CDC. It is my pleasure to nominate Sadie Foshay, my successor at PHEP, for the Maine Public Health Association's Rising Star Award. In January 2021, in the midst of a global pandemic, I had 1 month of joint service with Sadie as I said a bittersweet goodbye to the CDC team. I found Sadie to be a tireless worker, both in Augusta and across Maine, in a wide range of COVID-19 response efforts. Her Maine Response volunteer program has provided clinical and non-clinical volunteers to a variety of functions: contact tracing, public testing, administering vaccinations, supporting callers via the nurse advisement line, through the work of the Spiritual Care Corps and other efforts, and so much more. During her time in volunteer management, Sadie has successfully managed the largest, most robust volunteer engagement and deployment initiative ever undertaken in our state. Over the course of the pandemic response, this program has logged a total of nearly 41,000 hours of volunteer time across almost 7,000 shifts. The total value of this time is estimated between $1.25 and $1.5 million. In her short tenure, Sadie has managed to capitalize on public interest in helping their neighbors, and to date has grown the Maine Response volunteer base by around 60%. When I left, we had just shy of 3,200 volunteers. Sadie recently surpassed the 5,000 mark. So, Sadie, congratulations, and on behalf of the people of Maine, thank you.
Thank you, Ed. And Sadie, I now turn it over to you if you would like to make some remarks.
Absolutely. Thank you, Becca. And thank you to Maine Public Health Association for hosting this event, and to Ed Molio, who nominated me. I'm truly honored to accept this Rising Star Award. My name is Sadie Foshay, and I currently manage Maine CDC's emergency response volunteers under the Maine Response Program. And working under the leadership of Dr. Shaw, the director of the Maine CDC, and Public Health Emergency Preparedness Program supervisors, Bill Jenkins and Tammy McLaughlin, Maine Response programmatic volunteers were able to support critical COVID-19 missions across the state. As some people may be aware, I joined the Maine CDC in January of 2021 during the height of the pandemic. I entered the field in public health with a purpose to make substantial difference in public health, not only here in my community in Booth Bay, but across Maine. And with Maine Responds volunteers, they gave their time to contribute to saving the lives of their fellow Mainers. And I can never express enough gratitude for the work they've done and will continue to do. These volunteers stepped up and responded in the field to support missions, sometimes with less than 18 hours notice. Whether it was out with our mobile vaccination unit, traveling across the state, providing life-saving vaccines, or working inside local community centers in the height of winter to provide safe and secure access to COVID-19 testing, many of us wearing full winter gear, including long john snow boots and our warmest, deepest down jacket. We've also had some times for celebration. During the holidays at the Augusta Armory, we were able to celebrate with our giant saran wrap ball for awards, which was quite a sight to see. It's a great team building exercise. Or at outdoor gatherings with Central Maine Medical Center, celebrating the vaccination work that volunteers provided at the Auburn Mall. I look forward to the work that we will continue to provide supporting public health here in Maine by decreasing barriers across the state. Thank you so much. And this award is not only for myself, but for every person who stepped up during this response to improve the lives of their fellow Mainers and to those lives that were sadly lost. I'm optimistic for the future of Maine's public health and the continued collaboration between my colleagues and volunteers. I would be remiss if I didn't also thank my family for supporting me without question, even when it meant adjusting family celebrations or making sure that I just had a healthy meal to come home to and some laundry was done. So thank you to the tireless effort of the support of my family behind me, my colleagues, and thank you so much to every recipient tonight, and onward and upward.
Thank you, Sadie, and congratulations to you again. Our last award this evening, last but not least award this evening, is the Unsung Hero Award. This award is for those who work hard every day to protect and promote public health in whatever capacity is needed and with a commitment to excellence. The award recognizes an individual, department, or organization who has positively influenced public health in Maine from behind the scenes. This year's award winner is the LA Emergency Task Force, which is being recognized for its tireless commitment to supporting the New Mainer communities during the COVID-19 pandemic. The team was nominated by Abdul Karim Saeed, who will now share remarks about his nomination.
New Mainer Task Force responded to COVID-19 was formed in mid-March 2020 by the community organizer, community leaders, faith leaders, health professionals, and community members. The main purpose of task force was formed to address the need of the New Mainers community in response to COVID-19. Since then, the task force inform, educate, and eliminate myths and reduce the barriers. The task force addressed the unique problem facing the New Mainers community during the pandemic through a combination of educational outreach and providing a social support. The task force have been supporting the community through the new needs that arise, such as providing informational session, providing PPE to the community, coordination of mass testing through a provider, transportation to and from the testing and vaccine sites, making a referral to a community service, supporting language access. This task force during pandemic recorded over 1,500 audio and video through WhatsApp. This task force served a hot meal over 1,800 to elder and disabled during the months of Ramadan at 2021. This task force translated and interpreted for over 3,200 hours. This task force also fundraised more than $40,000 between 2020 and 2021. This task force distributed cultural food to 500 families between mid-March and June 2020. The task force also coordinates meetings with the Maine CDC, DHHS, municipalities, and other partners to discuss about the COVID-19. This task force provides a daily update about the COVID-19 educational awareness that tailored linguistically and culturally appropriate.
Thank you, Abdul Karim. Hibo Omer and Abdi Kadir Nagai are here now to accept the award on the task force's behalf. And I invite you now if you would like to make some remarks.
Thank you, Becca. We are honored to accept the award. Thank you for recognizing our effort for what we have done and will continue to do for our community. It means a lot to the group to be recognized for the hard work. The Unsung Hero Award will motivate us to continue to do the amazing work we are doing and try harder to serve our community. Thank you to Maine Public Health Association for the support in our efforts, and thank you for the community. Our determination and advocacy will only get stronger with this recognition because we are the voice of our community. With your support and leadership and financial help of many great funders, we have improved the lives of thousands of new Mainers directly and indirectly. Thank you so much, and congratulations to all the winners. Thank you.
Thank you, everyone. Good evening, ladies and gentlemen. It's an honor and a privilege to accept this Unsung Hero Award on behalf of LA Task Force. And I sincerely thank Maine Public Health Association for organizing our work. And thanks for Abdul Karim for nominating LA Task Force, and also as well the selecting members of the selection who selected our work. It's absolutely proud of and humbling experience for me and for my team members as LA Task Force. I would also like to extend my sincere appreciation and also gratitude for all LA Task Force members, as well as the family members who allowed us to risk their lives during the pandemic. And I also want to thank without community members and donors who make this possible. Without their support, this will not be possible. And this honor will stay in a great honor in our community, and I would like to thank you all.
Thank you, and congratulations. That was our last award for this evening, and I want to thank all of you for being here with us tonight and to congratulate again our award winners. Your collective contributions have protected and promoted public health, reduced health disparities, and improved the policies, systems, and environments that impact health outcomes in Maine. Thank you all. I always look forward to the awards ceremony because it's such a tremendous opportunity to learn about public health efforts that are going on in the state, to recognize the work of our colleagues, and to celebrate their accomplishments. I just want to thank you all again for being here. It's been wonderful to be here with you celebrating, and I hope you all have a pleasant rest of your evening. Thank you so much.